Hello, and welcome to our video instruction on how to use your infusion set. Please note that this guide is not a substitute for professional medical advice or for reading the instructions for use, which come with the product. Please refer to the most recent instructions for use for a complete list of warnings and precautions. When using the product for the first time, do so in the presence of a healthcare professional. The infusion set has a soft cannula and is inserted with an insertion angle between 20 and 45 degrees. Here you can see the parts of the infusion set: needle guard, soft cannula, adhesive tape, introducer needle, cannula housing, tubing, connector needle, circular protective cap, disconnect cover. Before you begin, check the sterile packaging. Do not use the infusion set if the packaging has been damaged. Wash your hands with soap and water before inserting the infusion set. Choose an insertion site as recommended by your healthcare provider. Check that the insertion site is free of skin irritation. Do not use an area right next to your previous infusion site. Clean the area for insertion with a disinfectant as directed by your healthcare provider. Be sure the area is air-dried before inserting the infusion set. Open the blister pack and take out the contents. Gently pull to remove the front paper from the adhesive tape. Carefully remove the needle guard by gently twisting and then pulling it off. Be careful not to touch the needle. Pinch the skin and insert the infusion set at a 20 to 45 degree angle. Gently massage the front part of the adhesive tape onto the skin. Place a finger in front of the cannula housing and remove the introducer needle by pressing on the grips on the side of the introducer needle and pulling straight out. Keep your finger in front of the cannula housing and remove the back paper from the adhesive tape. Avoid touching the adhesive tape. Gently massage the adhesive tape onto the skin. Remove the paper from the tubing. Gently squeeze both sides of the connector needle and pull the circular protective cap to remove it. Follow your pump manufacturer's instructions for use to connect the infusion set tubing to the pump reservoir and pump. Prime the tubing according to the instructions provided by the pump manufacturer until insulin dispenses from the needle. When priming the infusion set, hold it with the needle pointing down. Ensure there are no air bubbles remaining in the tubing. Never fill the tubing while the infusion set is connected to your body. Consult your pump manufacturer's instructions for use for further details about pump connection and filling of the infusion set. Place a finger in front of the cannula housing and push the connector needle straight in until you hear a click. Fill the empty space in the cannula following your pump manufacturer's instructions. This infusion set allows you to temporarily disconnect your pump without having to change the infusion set. Before disconnecting, wash your hands with soap and water. Place a finger in front of the cannula housing. Disconnect the connector needle by gently pressing the grips on the side and pulling it straight out. Connect the circular protective cap to the connector needle. Connect the disconnect cover to the cannula housing. Before reconnecting, wash your hands with soap and water. Gently squeeze both sides of the connector needle and pull the circular protective cap to remove it. Prime the tubing according to the instructions provided by the pump manufacturer until insulin dispenses from the needle. When priming the infusion set, hold it with the needle pointing down. Ensure there are no air bubbles remaining in the tubing. Never fill the tubing while the infusion set is connected to your body. Gently squeeze both sides of the disconnect cover and pull to remove it from the cannula housing. Place a finger in front of the cannula housing and push the connector needle straight in until you hear a click. Now you are ready to restart your insulin delivery. We hope you found this video helpful. For further information about the infusion sets, please contact your local infusion supplier or Convatec Infusion Care.